So today the topic that I chose was antihistamines. Um, and specifically I'm going to be talking about the risk and the relief that they provide. So for the table of contents, I went ahead and divided it into 10 slides. So the first slide is the title, second slide are what are antihistamines, followed by how they affect the body, the common uses, the risks and side effects, and then followed by misuse and abuse, and basically telling the difference between both of those, and then why this matters for college students specifically, and then some safety tips, and then wrap it up with a conclusion, and then just we're excited. So, what are antihistamines? They're basically a drug used to treat allergic reactions. So, when the body's exposed to allergens like pollen or any other type of allergen, it releases a histamine, a chemical that causes symptoms. And these symptoms can include sneezing, itching, runny nose, like the whole thing. And specifically, antihistamines block histamine receptors. So they reduce the symptoms that they cause. And some common examples are like Benadryl and Claritin, which are like, drugstore name brands of antihistamines. So, how they affect the body. So, antihistamines work by blocking H1 receptors in the body. First generation antihistamines like um, diphenhydramine cross into the brain and cause drowsiness. And second generation antihistamines cause are less likely to cause sedation. This is very important, especially for students who need to stay alert. Some common uses for these are for seasonal allergies, cold-like symptoms, skin reactions like hives, and sometimes as sleeping aids, which it's not really recommended for, but like that's the way people like sometimes use them for. Um this brings up the problem is like many people use them for just casual use for sleeping, which can be risky because it's not being like utilized properly. So what are some risks and side effects? Some common side effects include drowsiness, dry mouth, dizziness, and blurred vision. And some serious risks associated with this would be impaired driving ability, confusion, and increased heart rate. Furthermore, mixing antihistamines with alcohol can significantly increase their danger. But that's like a given. Like, I feel as though mixing alcohol with any sort of medication is like, it's just something you don't usually do. But I guess it still exists, so it's worth mentioning. Okay, so the difference between misuse and abuse. Misuse would be like people taking higher doses or using the antihistamines for unintended purposes, like sleeping or helping with sleep, or combining them with other substances to make them more effective, or who knows what else, but yeah, combining them with other substances. Abuse, on the other hand, can occur when individuals repeatedly take excessive amounts, which leads to dangerous side effects like hallucinations or heart problems. So taking like maybe 3 times the recommended dosage would be an example of abuse. Okay, why this matters for college students. I mean, to be honest, it really matters for everyone, but I feel like since, we're presenting this to people that are our classmates, it's worth mentioning why specifically it matters for college students. For college students, they tend to use antihistamines without thinking of the consequences, and maybe they just find it trivial. It's like not going to affect them, but taking them before class can reduce focus, and using them to help with sleep can disrupt like our natural sleep cycles. Furthermore, combining them with alcohol, specifically like at parties or gatherings, as such, can increase the risk overall of their dangers. So some safety tips. It's always good to follow the recommended dosage on the package for the medication. Avoid mixing with alcohol, and furthermore, choose non-drowsy options when needed. Be sure to read the labels carefully and use them properly. And if you still have any doubts, it's always good to get a second opinion from a doctor or anyone with related, a pharmacy technician, individual, anyone that has experience with these types of medications. And so, for the conclusion, antihistamines are effective and they are fairly accessible, but they are not risk free, just as any other medication. But the crucial thing is that understanding how they work and using them responsibly can help us avoid serious health consequences, all while still like getting the relief that they provide for allergies. So it's like a double-edged sword, but they are still fairly accessible, and that's a good thing. But it's just like it's good to be mindful of the things you're putting in your body and using them properly. And here's the works cited.